So, talking about how the disease develops in an individual. Now, I've already mentioned the fact that it is a multi system disease. Now, what do we mean by this particular phenomena that a lot of systems are involved in the development of this particular disease phenomena? We have the endocrine system, then we have the immune system. So the immunity basically lowers in the individual, and that contributes towards the development of this fatigue syndrome. Now, what does the patient have, or what does the patient experiences in this particular phenomena? He has flu-like symptoms almost, and then he always complains of chronic fatigue that he suffers from time to time. And this fatigue is even not relieved by sleep. So that is something that is highlighting the fact that the patient is not suffering from a normal fatigue that every normal person can suffer from. Now, when you have these patients at your hand, first of all, history is the key feature over here. You would have to focus on the fact, for instance, even the details regarding the age, the occupation that the patient has, and the gender. That is going to reveal a lot of factors, and basically females are more prone to developing this kind of a condition. That, as we even saw in our case study, we have a 38-year-old female Gracie who is suffering from this particular condition of myalgic encephalomyelitis. So females are more predisposed to this condition. Genetics can even predispose an individual towards the development of this particular condition. So a particular kind of a genetic makeup basically makes the person more prone to the development of this kind of a condition. Then on the other hand, we have energy metabolisms being involved also in the development of this particular condition. We have neurological factors as well. The underlying processes, the pathological processes would be a decreased response of T cells is noted down in the individuals. Then we have the increased number of pro-inflammatory cytokines that are also seen in these particular individuals. They are indicating basically the chronic infectious states that the patient might be having. Increased number of natural killer cells is again one of the phenomena that is seen in the individual. A lot of researches have been done what basically causes the prognosis towards this particular kind of a disease. It can be the environmental stresses as well. Childhood trauma, I would like to mention over here, is one of the key features that leads to the development of this particular condition. So if a person is having an unsettled childhood, that can make the person more prone to the development of this condition. So you would have to basically dig out features in the history. When you're asking a detailed history from the patient, that is basically making you more aware of the fact that what was the key feature for the development of the disease in this particular patient whom we are dealing with. It can be even stresses like multiple infections that the patient was basically exposed to. So any stressful conditions, may it be the medical conditions, may it be the environmental conditions, it can be even the psychological stresses. All of these contribute towards the development of this myalgic condition in the patient. Then the dysfunctions of the immune system is one of the key factor. Now the immune system can be lowered through a lot of factors. It can be even lowered through stresses. So stress is one of the key factor which lowers the immune system. An imbalanced diet is again one of the key factor that contributes to the decrease in the immune system. Lack of exercise, lack of sleep, stressful environmental conditions, even domestic violence can even lead to this particular development of this particular fatigue syndrome, specifically in the women. So female gender is more pre-exposed to the development of this myalgic conditions. This is again theoretical, and obviously a lot of theories have been put forth regarding the etiological factors and regarding the underlying pathophysiological features that can be seen in these patients. So the causative factors, if we tabulate them and have them in a flow chart, that is basically going to make it more easy for you to learn the causative factors in detail. What are the environmental factors? What can be the predisposing factors? And what can be the perpetuating factors in the history of the patient? Having a detailed history of presenting illness. For instance, when we went through the history of Gracie, we even had the past medical history of the patient, and that revealed the fact that the patient had been suffering from recurrent respiratory infections, and that was the cause of the decrease in the immunity and ultimately the development of the CFS, that is the chronic fatigue syndrome, in the patient. So this history and the history of presenting illness and the chronicity of the symptoms is going to reveal what were the perpetuating factors or what were the predisposing factors in this particular case. Now, regarding the predisposing factors, if we look upon these factors, we would be having the childhood trauma as one of the key factors. So you would ask the patient what kind of a childhood, even what kind of an adolescence the patient had. And these factors are going to relate to this particular kind of a disease. If the patient had suffered from some sort of physical abuse, or it can be even some sort of a psychological aspect of abuse that led to the traumatic history the patient can have, and this history of abuse has to be documented in detail because that can connect towards the development of this chronic fatigue syndrome in the individual. So you'd have to highlight these factors when you are taking the history in detail from the patient. Now, obesity and physical activity are basically two factors that go side by side. So if the patient gives you a history of physical inactivity due to any kind of reason, for instance, the patient can be obese, there can be some sort of a physical impairment that the patient is suffering from, or psychological impairment, and that is basically resulting in the inactivity of the individual, or it can be even a mere lack of interest in the physical activity or the lack of exercise. And we even can reconnect this physical inactivity with the decrease in the immune system. So these are some of the connecting factors that we have to highlight in the history. The habitual factors, the social factors, all of these are inculcated over here, and we highlight all of these factors in the history when we are taking the history in detail. Now, a lot of comorbids exist when we have these patients of the chronic fatigue syndrome. Renal diseases, as well as hypothyroidism is one of the key factors. Then we have SIBO, that is basically the bacterial overgrowth in the small intestine is one of the comorbid conditions. Then patients who are suffering from autoimmune conditions, that is basically going to make the patient more prone to the development of this fatigue syndrome as well. It can be even related to the intake of steroids on the long-term basis. That is even sometimes leading to the development of this chronic fatigue syndrome in the individuals. We have conditions such as endometriosis. And then we have the adrenal insufficiency, we have the IBS, that is the irritable bowel syndrome, that is sometimes connected with the development of this particular condition. We have TMJ, and then we have the intestinal cystitis. So all of these comorbids basically make the patient more prone. We have a long list over here. That is why it's sometimes quite confusing how to diagnose a patient that this particular patient is suffering from this chronic fatigue syndrome, because the comorbids usually overlap the clinical picture. So this particular clinical picture, the patient would be even having fever. The patient would be even having a raised ESR when the labs are conducted. So you won't have that particular diagnosis in which the patient is just suffering from chronic fatigue syndrome, or he or she is not suffering from this comorbid conditions. It can be even a sequel, it can be even a complication of this particular condition, or even the coexistence or the pre-existing conditions these comorbid conditions basically make the patient prone to the development of this CFS. So this is again a vice versa condition. It can be the comorbids leading to CFS. It can be the CFS leading to the comorbid conditions. It can be either way. So you have to basically rule out what the patient is suffering from. You have to conduct the tests accordingly. The thyroids have to be checked for. You have to basically comment on the thyroid status of the patient as well over here. These are the key features that you have to keep in mind. Then again, apart from the medical illnesses, the patient can also suffer from mental illnesses. For instance, the patient can suffer from depression, anxiety, panic attacks, and all of these can again lead the patient, even for instance, when you look at the bipolar disorders, the patient would have this extreme fatigue that the patient would be suffering from whenever he's in a phase of depression on one hand. So these are the symptoms that are overlapping. The psychiatric illnesses are even overlapping with this condition of fibromyalgia, or this condition of myalgic encephalomyelitis, or this viral condition. The post-viral syndrome is one of the phenomena that is seen coupled up along with this particular condition. Premorbid hyperactivity is decreased in these individuals. So usually the patients would be suffering from obesity, as well as the patient would be suffering from a history of inactivity. Now, a collateral history is very important over here. You have to take the history from the relatives. You have to take the history from the friends. And that is going to reveal a lot of factors. What kind of lifestyle the patient had before this particular illness. The inactivity, and basically when you asked the patient's relatives and the friends, they would highlight the fact that the physical inactivity was also related to some sort of psychological factors as well. So anxiety and panic attacks and depressions can be highlighted when you take the comorbid collateral history from the patient's relatives as well as from the patient's friends. The precipitating factors are also taken into account, and you look for somatic events in the patient. Any kind of infectious states that the patient is suffering from, recurrent infections that the patient is suffering from, any kind of past surgical history in the recent past or even anywhere in the past. For instance, a lot of children undergo a lot of herniation histories, and then they undergo a series of surgeries in their childhood. And these surgeries in their childhood is basically again making the patient more prone to the development of CFS. Pregnancies can even make the patient more prone to the development of this condition. Now, again, one have to focus on the fact that these are the precipitating factors. These are not the predisposing factors. These are the factors that is going to again precipitate the disease in the individual, which has already developed due to the predisposing factors. Psychosocial stress is again one of the factor. What kind of lifestyle the patient is having, what class of economy the patient belongs to is again very important. Whether he belongs to a lower socioeconomic group or a middle socioeconomic group, that is again going to reveal the fact what kind of a stress level he has to deal in with on daily basis. Life events, for instance, the death of a loved one early in the childhood, early in the adolescence, the death of the parents, of either of the parents, the death of a sibling. These can be one of the tragic events that the patient had to face, and that is making the patient more prone, or that is precipitating the disease of CFS in the patient. Then we have a list of perpetuating factors. So when we go through these lists of perpetuating factors, we have the non-acknowledgement by the physician. Sometimes the physicians would treat these patients as maligners. So when they think that these are not actual signs and symptoms, and there's some sort of functional problem that the patient is suffering from, and the disease is not acknowledged by the physician, then these factors can sometimes perpetuate the disease as well and make the conditions more severe for the patient. The negative self-efficacy is, again, one of the factors that the patient denies that he or she is suffering from any kind of a disease. So the self-denial is one of the mode that is going to aggravate the factors more in the patient. These are some of the perpetuating factors that we have to look for in the history as well. Strong physical attributions. This is again on part of the patient. And then we have a strong focus on bodily symptoms. So it's just the fact that the patient or the physician, on either hand, they are just focusing on the bodily symptoms and they're not treating the psychological symptoms, or they're not treating the psychological aspects of the disease in this patient. So then it would be basically a perpetuating factor in the patient, because even a case study, a PACE was conducted, a research study was conducted in which it was found out that cognitive behavioral therapies brought an improvement of almost 60% in the patients. So even the cognitive behavioral therapies, the psychological therapies have to be coupled up with the medical therapies and treating the comorbid conditions, and then only the patient is going to revive in a particular way and the prognostic factors are going to improve for the particular patient. The fear of fatigue. So there is an inconstant fear in the patient that the patient is going to be fatigued, and he or she basically is in a state of self-denial again, and it is again one of the perpetuating factor. Lack of social support, so the people around you sometimes doesn't support this particular diagnosis and the reality of this particular diagnosis, and that is why there is a lack of treatment or the lack of social support that is given off for these particular patients. For instance, if a patient is suffering from some sort of a condition of hyperthyroidism or any other kind of a medical condition, a lot of social support is always there on part of their family, on part of their friends, even at the workplace. But if a patient is diagnosed with this particular kind of a condition of myalgic encephalomyelitis, usually there is not a lot of social support seen at home or even at workplace, because it is not really considered a diagnosis of reality in a lot of cases. Low physical activity pattern is seen, so the patient usually suffers from inactivity as well as, in consequence, he suffers from obesity. Now, there are a lot of underlying pathophysiological factors that are contributing towards the development of this particular disease in the patient. We'd be looking at the metabolic alterations that are in turn resulting in the immune activation and dysregulation, and that is in turn relating to the ANS dysfunction. All of these are interconnected. An autonomic nervous system dysfunction is connected to the metabolic alteration, in return connected to the immune dysfunction. And all of these are contributing to the development of the chronic fatigue syndrome or myalgic encephalomyelitis in the patient.